nga Uganda yegasse ku mawanga amalala mu nsi yonna okulaba nga tukuba ttooki mu kaweefube w'okulwanyisa akawuka ka mukenenya. Mbadde nkyakugamba emabegaawo nti siriimu oba AIDS essaawa eno aliwo mu katuubagiro ka COVID-19 ekirwadde ekyo ssenyiga omukambwe Lumiima Mawuggwe bwe yajja n'asobya nti abantu ne batasobola kugenda kubatesitinga kwegamba naye n'aleetawo challenges oba okusoomooza okw'enjawulo. Katusooke tuwulize minisita w'ebyobulamu Dr. Jane Ruth Aceng Achero ayogereko gye tuli tujja kudda. Nze Dennis Blair Kalanzi.
Thank you very much, the Chair of the AIDS Committee, Your Excellency, the President of the Republic of Uganda, Honorable Ministers present, Honorable Members of Parliament, the Diplomatic Corps, our development partners, heads of government institutions, our esteemed religious leaders, Uganda AIDS Commission, members of civil society organizations, the private sector, all invited guests, ladies and gentlemen. Your Excellency, allow me to thank you for gracing this commemoration of the World AIDS Day. Your presence is a powerful reminder to Ugandans that though we have made progress, AIDS is still with us. It is also a reminder to all of us of your commitment to end AIDS by 2030. On behalf of the Ministry of Health, I join the people of Uganda and the global community in commemoration of today's World AIDS Day. On this day, we take a pause and reflect on the journey that we have walked together, the achievements we have made, and the challenges that we face in the implementation of the HIV response in Uganda. On this day, we also come together to affirm our collective solidarity with the people living with and affected by HIV and AIDS. We also fondly remember those who have died because of AIDS. Your Excellency, the Ministry of Health recognizes and embraces the 2021 World AIDS Day theme, End Inequalities, End AIDS, and End Pandemics. And our local theme, End Stigma, End AIDS, and End Pandemics. This calls upon all of us to rally our support and solidarity towards ending AIDS. It also reiterates every individual's responsibility to protect themselves, their families, and their communities from acquiring HIV infection. The theme reminds us that although AIDS is no longer perceived as a death sentence, it is still with us and it is not yet over. On this World AIDS Day, I congratulate all the AIDS control stakeholders who have worked alongside the government of Uganda in addressing this big challenge. Together, we have made tremendous progress towards the HIV epidemic control and ending AIDS as a public health threat amidst a difficult environment caused by the COVID pandemic. And I want to thank all our partners who, together with us, came to address the challenge and put us back on track. As we close the year, we take stock of our achievements and the progress we have made towards attainment of the 95-95-95 goals. Since the HIV epidemic control in Uganda has not attained what we intend to achieve, we continue to make estimates of the numbers. Your Excellency, to date, 1.4 million adults and children are living with HIV. Adults aged 15 years plus accounted for 93% of this burden, with 62% of HIV-infected adults being female. It is estimated that about 38 new HIV infections occurred during 2020, 37,000 of them among adults. Young adults 15 to 24 years accounted for 41% of new HIV infections, with a male to female ratio of nearly 1 to 3. AIDS-related mortality dropped from approximately 23,000 in 2020 to 22,000 in 2021. Your Excellency, in implementation of the HIV programs, we continue to prioritize primary HIV prevention interventions. Last year, we continued to promote the ABC model of abstinence, faithfulness, and consistent use of condoms. We also intensified social behavioral change communication programs utilizing multiple media channels, including print, radio, television, roadside billboards, posters, leaflets, and interpersonal communication. We are grateful for the collaboration with civil society networks of people living with HIV, religious and cultural leaders in the implementation of these programs. The Ministry of Health has also been utilizing film vans to support HIV awareness in the country during this time of the COVID pandemic. Last year, additional film vans were procured, and 2 others are in advanced stages of procurement to augment these programs. The film van capacities are also being utilized in support of community mobilization for COVID-19 prevention programs, as well as other diseases, including non-communicable diseases. In a special way, allow me to appreciate the Global Fund, USAID, and UNFPA, who have supported the procurement and distribution of over 3 million condoms in the country. Condom distribution is done through total market approach involving the public sector, that is through national medical stores and joint medical stores, through the private sector and social marketing. For user end distribution, the Ministry of Health procured and installed an additional 4,000 condom dispensers across the country. Your Excellency, the Ministry of Health and partners, PEPFAR and the UN, have continued to provide safe male circumcision as a key element of the fast-track package for HIV epidemic control. There is significant evidence of its impact in reducing new HIV infections. Our approach has been to prioritize young men 15 to 29 years in regions with high HIV prevalence and high unmet need for circumcision. In the last year, 510,000 men out of an annual target of 850,000 were circumcised. A cumulative total of 6.5 million men have been circumcised since 2011. Your Excellency, the Ministry of Health has strengthened interventions for prevention of mother-to-child transmission. Testing for pregnant mothers has remained high at 98%, and enrollment to antiretroviral drugs for HIV-positive women is at 96%. We estimate that 5,300 perinatal HIV infections occurred in 2020. This represents a significant reduction in perinatal HIV infections from a peak of 28,000 in 2010. We shall continue to address the factors that contribute to breakthrough infections. Towards these efforts, we shall conduct sustained HIV testing and enhancement of retention on treatment for pregnant and breastfeeding women. Your Excellency, we have continued to strengthen the implementation of HIV care and treatment program. In the year, we completed and embarked on full-scale implementation of the 2020 Consolidated Guidelines for the Prevention and Treatment of HIV and AIDS in Uganda. These guidelines provide for the transitioning of patients to more efficacious and optimized HIV treatment regimens. The number of adults and children active on ART increased from 1.22 million in 2019 to 1,280,000 in 2021, a coverage of 91% of all HIV-infected individuals. Of these, about 93% are adults, 15 years plus, while 7% are children aged 0 to 14 years. The number of ART treatment facilities were 2,015 across the country. In the coming year, the Ministry will focus on bridging program gaps among men, young people, and key populations. We will strengthen the identification, linkage, and retention of men and adolescents in HIV treatment cascade. Your Excellency, during the year, we also prioritized the collection of vital strategic information to guide strategic planning and monitoring of HIV epidemic control activities. The Ministry has continued to strengthen the routine data collection systems through the district health information systems. The 2009 annual Sentinel surveillance survey was also conducted, and it provided data that we utilized in the production of the annual estimates that you have been hearing. In the area of generation of strategic information, we remain committed to the provision of evidence that informs our HIV programs. Against this commitment, the Ministry conducted a national population-based survey of HIV/AIDS in 2020, what we call the UFIA, to provide empirical population-level data on a wide range of program indicators. The findings will be available in early 2022 to inform the future of the program efforts in a fundamental way. Working with stakeholders under the guidance of the Prime Minister, UBOS, UNHCR, CDC, and ICAP, the Ministry is conducting a population-based survey among refugees to determine the magnitude of HIV and other program indicators among the refugees in Uganda, and this will be communicated as well. The data collection will be completed during the later part of 2021 and results communicated accordingly. The HIV case-based surveillance involving longitudinal follow-up of people living with HIV was successfully piloted in the CDC-supported areas of Kabarole and Hoima districts, including the use of unique identifiers. The future direction involves working with stakeholders on establishment of a central data warehouse and an enterprise architecture as a key feature of the program. Despite all the efforts and burdens of HIV/AIDS, the epidemic remains enormous. Your Excellency, in a special way, allow me to thank the United States government through PEPFAR, the Global Fund, and the United Nations, WHO, UNAIDS, UNICEF, UN Women, and UNFPA, who have greatly supported our response to HIV. We also appreciate the bilateral and multilateral partners, including Ireland Aid, the World Bank, and FCDO for your unwavering support. Allow me also to appreciate the networks of people living with HIV and the private sector that are contributing to this response. Lastly, Your Excellency, allow me once again to extend our sincere appreciation to you for your extraordinary leadership in the fight against HIV/AIDS in Uganda and all the pandemics that we have and may continue to have. And allow me to remind all Ugandans to take a step and get vaccinated against COVID-19. The vaccine is widely available, and the vaccine that is given to you is the best vaccine. I thank you all for listening to me, for God and my country.
I thank you, Dr. Ruth Acheng, for those remarks. Your Excellency, as part of the preparatory activities for World AIDS Day, 200 young people drawn from the 5 divisions of Kampala underwent 5 days training in HIV prevention, patriotism, and mindset change. This initiative was supported by the Patriotism Secretariat under the Office of the President, Kampala District Youth Council, Uganda Scouts Association, and Uganda AIDS Commission. The trained youths are going to mentor 10,000 other youth in HIV prevention, patriotism, and mindset change in the 5 divisions of Kampala, and we believe this can be achieved by 30th December 2021. Therefore, Your Excellency, we shall request you that at the end of your address to the country, you will perform another cardinal role of passing out these young men and women so that they can go out there and create a change in the minds of other youths in the issues and in the area of HIV and AIDS. Therefore, Your Excellency, allow me at this time invite Honorable Mile Babalanda, the Minister in charge for the Presidency, to come and make her remarks, but also introduce to us the other ministers who are in the gathering with us, to you, and thereafter invite you to address the nation. Thank you very much, Your Excellency. Honorable Minister, you're welcome.
Your Excellency, the President of the Republic of Uganda, Commander-in-Chief and National Chairman of the mighty Party NRM, retired General Yoweri Kaguta Museveni. Cabinet Ministers present, Your Excellency, among the Cabinet Ministers we have here, we do have Honorable Dr. Jane Ruth Acheng, Minister of Health. Honorable Dr. Mori Kukaduchu, Minister of State for Primary Education. Honorable Mary Grace Mugasa, Minister of State for Public Service. The Archbishop of the Anglican Church and Chair of the Interreligious Council, ambassadors present, the UN Resident Coordinator, the Chairperson Parliamentary AIDS Committee, members of Parliament present, the RCC Kampala, permanent secretaries, all development partners, the Senior Mayor, Kampala Central Division, the town clerks, representatives of people living with HIV, ladies and gentlemen. I am honored and privileged to welcome all of you to this important day when we commemorate the World AIDS Day in Uganda. I wish to thank the Uganda AIDS Commission and our partners for organizing this colorful event amidst the COVID-19 pandemic. Each year, Uganda AIDS Commission, under the Office of the President, mobilizes partners at national and subnational levels to observe and participate in activities marking the World AIDS Day. This event provides a powerful advocacy platform to awaken communities in the fight against HIV and AIDS and to reflect on our successes and challenges in the fight against the pandemic. Your Excellency, we applaud your strong leadership in the fight against HIV and AIDS, which has been demonstrated globally since the onset of this pandemic. You rallied all Ugandans to come together to fight this common enemy, and indeed, a lot has been achieved, as reported by the Director General of the Uganda AIDS Commission. To our development partners, we wish to appreciate your unwavering support to the government of Uganda in this area. We pledge to work with you in the fight against HIV and AIDS and other pandemics. As government, we recognize all the contributions and all the support you have rendered to the HIV/AIDS response. Your Excellency, since I assumed office, I have seen and I hereby commend the partnership approach government adopted and is implementing through the Uganda AIDS Commission to bring all the partners together to work towards achieving a common goal. I receive monthly reports from the Uganda AIDS Commission on key strategic areas that stakeholders are engaged in, including government and non-government institutions that are tackling the AIDS pandemic in the country. I would like to say that indeed, great success and progress is being made. I therefore congratulate and I urge you all stakeholders to continue working and supporting those infected and affected by the HIV for the betterment of our country and for attainment of the Vision 2040. However, Your Excellency, there are those friends of ours in the name of partners who had made it their cause to use the AIDS platform to steal from donors and the people infected and affected by the AIDS problem. I accordingly directed the Director General of the Uganda AIDS Commission to strictly regulate operations of our stakeholders and to deal with the problem of fake AIDS organizations. Ladies and gentlemen, this year's National World AIDS Day theme is End Stigma, End AIDS, End the Pandemics. I appeal to all of you to recognize and support the persons living with HIV and AIDS in various ways, including the following. Let us recognize the 1.4 million people living with HIV in Uganda. This will ensure that they come out of hiding in order to access HIV services without any fear. Let us offer them maximum social and emotional support in order to promote their dignity and positive living. Let us stop stigmatizing them. Ladies and gentlemen, in line with the above, the country has put in place measures to ensure HIV is mainstreamed in all sectors under programs of the Third National Development Plan. At this point, I wish to recognize the efforts of the members of Parliament under the leadership of the Right Honourable Speaker and the committee chairpersons who have promoted the AIDS agenda in legislation. You have supported the national cause for HIV and other pandemics. Please continue to offer this badly needed leadership and guidance, especially our young people who are our future leaders. I wish also to thank my colleagues, the ministers and all the government officials who supported and continue to support the people living with HIV and AIDS during the COVID lockdowns. The communities of people living with HIV and AIDS express their gratitude for your involvement and assistance. Indeed, Your Excellency, I have challenged all our leaders to always dedicate at least 2 to 5% of their public speeches to issues of HIV and AIDS as one way of re-energizing the message of AIDS in the population. To the people living with HIV and AIDS, I wish to thank you for standing firm, shining and contributing to national development. You have given your views and proposals on where the interventions and focus should be in order to attain results. Our chief guest, sir, as I conclude, I wish to mention that your wisdom and leadership made Uganda to be among the 8 countries in the whole world that achieved the global target of 90-90-90 by December 2020. This is to say 90% of the population gets tested for the virus, and 90% of those who test positive are put on treatment, and eventually 90% of those on treatment are able to sustain on that treatment. Your Excellency, we have now adopted the new global targets of 95-95-95. Indeed, Your Excellency, after all these achievements, and with only 9 years left to the national target of completely ending AIDS as a public health problem in 2030, the Uganda AIDS Commission, at my proposal, is planning to document and put on record for the future generations all the atrocities committed by this virus to the people of Uganda since 1980. The Uganda AIDS Commission is planning to establish the first ever Uganda AIDS Memory Museum. This museum will showcase and explain to our young generation who did not see and neither feel the toughness and effects of this terrible pandemic especially in the early days of the 80s. The museum will also document the long journey of the NRM government and especially your leadership in the battle against this enemy. The Uganda AIDS Commission already has land in Kampala City where this project can be established, but will need funds to construct and equip the museum. Your Excellency, despite all the above, however, the master plan for ending AIDS as a public health threat by 2030 still requires heavy financing and human resources. Resources will be needed to achieve the targeted interventions which are highlighted in the National HIV Strategic Plan 2020-2021 to 2024-2025. I therefore call for increased facilitation to the national response and adequate funding of the Uganda AIDS Commission, sir. Your Excellency, in support of your initiative to end AIDS by 2030, Kampala Capital City Youth, with support from the Uganda AIDS Commission, the Uganda Scouts Association, and the Uganda National Patriotism Secretariat, trained 200 youths as peer mentors in HIV prevention, patriotism, and mindset change. This training took place at Kaz Scouts Ground. Representatives of these youth from the 5 divisions of Kampala are here today, and I request you, sir, to commission them after your speech. The trained youth will take the message of HIV prevention to the 5 divisions of Kampala. It is anticipated that at least 10,000 youths will be reached and skilled in HIV service utilization by 30th of December 2021. Sir, on behalf of the Uganda AIDS Commission, and as the Chief Coordinator of all the agencies in the fight against HIV and AIDS, allow me to commend you for the great effort you have displayed in the fight against the COVID-19 pandemic. However, I need to report to you that while we focused on the COVID-19 challenge, there was a big laxity in the fight against AIDS. We do have fears that due to the effects of the lockdowns, there may be a resurgence in HIV infections countrywide, just like it has happened with the teenage pregnancies. And now with the new COVID strain of Omicron doing the rounds, we need to double vigilance, especially through the media, to counter its impact on our already vulnerable society and especially on the AIDS situation in the country. Your Excellency, because of the seriousness of this matter, I have been engaging leaders in forums organized by the Uganda AIDS Commission to remind them of their roles in the fight against HIV and AIDS, and I have commissioned them to be HIV AIDS ambassadors in their communities. I have had good support from the Speaker of Parliament, the Right Honourable Jacob Olanya, who has been very instrumental in mobilizing the members of Parliament to support the activities of the Uganda AIDS program. I am, however, challenged to report to you, Your Excellency, the health workers and other caregivers, especially in our up-country stations, who continue to mistreat and stigmatize HIV and AIDS patients. This is counterproductive to the targets we have set to end AIDS by 2030 and should be stopped. It is now my honor and privilege, Your Excellency, to invite you, the acclaimed Global AIDS champion, to come and address the nation. I thank you.
Thank you. The Honorable Ministers, the members of Parliament, His Grace the Archbishop and the religious leaders, Excellencies the ambassadors and heads of missions, representatives of people living with HIV/AIDS, all representatives from government ministries, departments and agencies, all invited guests, ladies and gentlemen, including all of the people attending online. I'm pleased to join you today at this important event where Uganda joined the rest of the world to raise awareness again of the AIDS pandemic caused by the spread of the HIV infection and remembering those who have died of the disease. Today marks 33 years since the commemoration of the first World AIDS Day in 1988. It is approximately 40 years since the first case of AIDS was discovered in Uganda in Kalisis Hospital, coming from the shores of Lake Victoria in Rakai district. My story with AIDS starts around 1983 when we were in the bush fighting. There was one of our soldiers who got sick, and the doctors we had in the bush tried everything possible to treat him. They treated malaria and many other things, but they could not know what the person was suffering from until the person died. I remember that boy very well. He was called Black. We couldn't know what this sickness was that could not respond to all the known treatments. We came to know that when we were going to the bush, this soldier had hidden in Rakai district, which at that time apparently had become the epicenter of the epidemic. We did not know that time what had killed that soldier. I tried to talk to Dr. Bata and Dr. Vesige about this boy, but nobody had an explanation. I'm always interested in health issues. Then around 1984, I started hearing on the radio that there was a new sickness of homosexuals which had no medicine. You know, that's how the whole story of AIDS started here. I said to myself, that's no problem. We don't have many homosexuals here. so I didn't bother so much. Around 1985, I was listening to the BBC radio program, and there was a female doctor in Zambia from Italy. I think her name was called Dr. Ombeli. I had her on the program of BBC saying, no, this disease does not affect only the homosexuals. I have seen a number of patients who are not homosexuals in my clinic. I called my army officers who were with me in the bush, and I warned them. I said, there's a new sickness which people were originally saying it was for homosexuals, but now I have had a doctor in Zambia saying that she has seen people who are not homosexuals who have been affected by that disease. Then I forgot about the problem, and we were busy with other things, including taking over Kampala, until September 1986, when I had gone to attend the Non-Aligned Movement Conference in Harare. Conference, the late Cuban leader, Dr. Fidel Castro, took me aside and told me that there is a big problem in my country. That's what Castro actually is the one who told me. Fidel Castro, in Harare, September of 1986. How did Castro come to know about this? Apparently, we had sent 60 soldiers from here to Cuba for training. For us here, we were not checking for AIDS, but the Cubans were already aware, and they were checking all these people. When our soldiers went, 6 of them were tested, and 18 of them were HIV positive, which is 30% of the 60. Dr. Castro's system was very efficient. He told me that those 18 were going to be sent back, and the others would stay and finish their course. When I came back, I called a meeting in Republic House, the Minister of Defense, and we had a meeting with Dr. Okware. Is Dr. Okware here? That's a veteran of our struggle. When I called Dr. Okware, I interrogated him. Because now I had started hearing that the AIDS was spreading through blood to blood. That the blood of the infected person, if it mixes with the one of the one who is not infected, the other one will be infected. So I asked Okware, you know, these doctors of Uganda are good, but they don't know how to communicate. This is their problem. I said, if that is the case, then that means that the mosquitoes can spread this AIDS. Okware said, no, mosquitoes cannot be spreading the AIDS. Why? He said that because in the households where people are dying, the children don't die. It is only the adults who die. This means that whatever is killing them does not affect the children. And we think it is because the children are not sexually active. That's why they are not dying, and yet they are in the same household. If it was, if mosquitoes were involved, even the children will be affected. So then I said, but if you knew this, why didn't you talk about it? He said, yeah, we'll put some few announcements on the radio saying, love carefree. There are some whisper on the radio. I said, Dr. Okware, but this one, once the lion comes to the village, you don't whisper. You make alarm, enduru. So that's when I went out. Actually, that's why we put the AIDS Commission in the President's office, not in the Ministry of Health. Because we could see that the issue here now was enduru. Enduru is a word for alarm. And since the Ministry of Health people are not famous for enduru, they just whisper. We say, no, you put it where people who can shout. And shout intersectorally. Because this was not just a health issue, it was an awareness issue. Because now we came to understand that really there were only a few ways in which the AIDS was spreading. Number one, the main highway, the Wanyankore call it Umuhanda Ligendwa, the main highway of HIV spreading was sex. That was the main road. The second one at that time was blood transfusion. So with blood transfusion, we quickly got how to handle it by checking the blood of people who are donating blood. And then for some reason, and this is where I had my argument with Okware, the injections, at that time they were using reusable syringes. So my arguments with Okware was, but if the mosquito doesn't spread the virus, but why would the syringe do so? And Okware had the answer. The answer was the proboscis of the mosquito is very small. It does not have too much, does not carry too much blood, while the syringe is bigger, can carry more virus. So that is the story of AIDS here. From that time, we decided that enduru was the main weapon. The alarm, talking. Then with the story of AIDS, we continued. When the ARVs came, we were told that somebody to use them must keep testing until his CD4 count falls to 500. You know, we're really involved in all these battles. When the ARVs came, they said, no, we keep monitoring the patient until his CD4 count goes 500. And then we said, what is the normal person supposed to, how many are his CD4s? I think that time they told me 800 or something like that. That when they reach 500, that's when he should start using ARVs. I asked them, why does he not start from the beginning? They said that these ARVs are also poisonous. They fight the AIDS virus, but also do damage to the body. So it is better the body fights on its own for some time, and when you see it is losing, then you come in with this weapon, which kills the virus, but also damages the body. Now, much later, it is Michel Sidibe, I don't know where he is now, who told me that the strategy had changed. This was much later, like 6-7 years ago. He said that now, as soon as you test and you find that you have the virus, you take the drugs. Then my question was, what has happened now? Because the other time they were saying the drugs were also very bad. They said drugs had come, I think better drugs, and when you take them, it is better than when you delay. I think the drugs had become safer or what, something there. Now, for some reason, I had not heard this from, this is really the problem. The problem, because I got this from Sidibe. Sidibe, you know, Sidibe is an expatriate from somewhere. But here within Uganda, nobody had told me this. This is part of the problem, where the one who knows doesn't talk, keeps the knowledge to himself. I think it makes people very important. I got this from Sidibe. You can even check. It's not long ago. It's about 8 years, or so, much recently. So I would like to recognize those who joined and tirelessly fought AIDS to give Ugandans hope. For example, Mrs. Norin Kareba. Is she alive? She's alive. For coming up with the idea of the AIDS support organization TASO. That gave Ugandans hope. Now, Michel Sidibe now told me two things. First of all, that it is better to start from the very early, swallowing the drugs. And then secondly, that apparently, which is what people are now repeating here, that the ones who are taking the ARVs apparently don't pass on the virus, don't infect others. But this was new information, which they were not talking about here until this Sidibe came. At that time, he was working with a Kenyan girl. There was a Kenyan girl there. Then I said, but if that is the case, then things are easier now. If, number one, the drugs are safer, you can swallow from the beginning, and then Once you swallow, then you no longer infect, then that makes the battle winnable. We have therefore come a long way, but I think behind all this is a defective strategy of not understanding the importance of public health, getting health by involving the public, sensitizing the public. Once the public know what to do, things are much easier. You will save a lot of. But some of the health workers prefer to keep quiet so that they are rich in patients. The more patients you have, the better. And many of the patients are patients because of ignorance, because they don't know what to do. That's why you even hear that in Uganda people have got malnutrition. Malnutrition, why? Here we've got all the foods are here. But the people are not told what to do. So, and as you know, 80% of the diseases which affect Ugandans are preventable. And many of them are preventable by behavior change or knowing what to do. We have therefore come a long way in fighting against HIV and AIDS, and today I can say with confidence that we are winning this battle. If there has been a relapse during the corona, then we shall regain. There are about 37.7 million people who are living with HIV globally. 1.5 million of the people were newly infected with HIV in 2020 alone. 73% of the adults living with HIV received lifelong antiretroviral therapy, and 680,000 people died from HIV illness. In Uganda, HIV prevalence reduced to 5.4% in 2020 from 18% in the 1980s. 1.4 million people are living with HIV in Uganda, and of these, 1.2 million are on treatment. Of course, the number in Uganda is growing of the people living with HIV because it is cumulative. People are no longer dying; they are no longer dying. So it's not like in the past when so many people would die. The main message for